how are you today?
Doing wonderful, thank you.
Awesome. Nice to meet you.
Nice to meet you as well. My name is Luna Lux.
Oh, thank you for that. How do you spell that?
Luna Lux.
Perfect. I do see that you're in our system. And you're here for a head to toes yearly checkup, right?
Correct.
Perfect. And the last time you saw a doctor was?
More than 6 months ago.
Okay. Alrighty, and what is your date of birth?
February 1st, 1992.
And what is your phone number?
555-902-3637.
Okay, so before we start, I just have a few questions. Do you have any allergies?
No allergies.
Do you take medications or vitamins?
I take daily vitamins and melatonin before bedtime.
Okay. Do you take melatonin every night?
Every other night, maybe.
Okay. Okay, is there any family medical history that I should be aware of?
No, nothing major.
Okay. Do you exercise regularly?
I try to 2 to 3 times a week.
Have you ever had hypertension or elevated blood pressure?
No.
Do you use tobacco?
No, I do not smoke.
Okay. Do you drink alcohol?
1 to 2 drinks a week. Yeah.
Not bad. Good. Have you ever had any blurred vision?
No blurred vision. No.
Are you having difficulty breathing right now?
No.
Okay. Has anything changed in your health in the last year?
Maybe I'm not sleeping that well as I used to at night.
Okay.
I struggle with that.
What do you think the reason for that could be?
Just stress.
Okay. I just have a few more questions about your health, and we'll get to your medical exam. Number 1, have you had or do you have diabetes?
No.
Do you have COPD?
No.
Asthma?
No.
Bleeding disorders?
None.
Do you have any tinnitus in your ears?
No, I hear pretty well. Yeah.
Have you had a sinus infection recently?
No.
Seizures?
No.
And back to sleep. How many hours do you normally get?
Normally I'd say 7 hours.
That's pretty good.
On a bad night, maybe 3 or 4 maximum.
How many times a week do you say you've had a bad night?
3 to 4 times a week.
Okay, so I'm not going to dig too deep, but what do you think you could do to lower your stress levels so you could sleep better?
So I've been watching ASMR videos on YouTube which have helped a lot to relax and just induce sleep. Yeah, that works really well.
That's awesome. Okay, a few more questions here. Have you ever had a stroke or anybody in your family?
No.
Any major surgeries?
No, no major surgeries.
Have you ever had tonsillitis?
No.
Thyroid problems?
No.
And lastly, any serious injuries that I should be worried about?
No, no injuries. I'm pretty healthy overall, other than the sleep problem. I don't have much going on.
Okay, that is definitely something that we could work on.
Yes.
All right, so we're going to start off by checking your vital signs, okay?
Sounds great.
Thank you. So I'm going to put some hand sanitizer on to start off with before I put my gloves on. Can you tell me what time of day it is?
Mid-afternoon.
What you had for supper yesterday?
I had broccoli soup.
And your favorite food?
Salmon.
Good, okay. My gloves here. Now, are you in any pain right now?
No pain.
Okay. I'm going to start off with your oxygen levels and your pulse. Have you just rest your hand on my hand. I'm going to count to 1 from 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Awesome. Your oxygen level is at 97 and your pulse is at 98 beats per minute. Next, I'm going to check your temperature. Just going to put this from your forehead all the way down to underneath your ear, okay? So I'm just going to move your hair. Okay. Just relax. Okay, you're at 97.8, which is a great temperature. Now I'm going to check your blood pressure with this blood pressure cuff. Which arm would you prefer?
I prefer the left arm.
Perfect. It should not hurt. Have you had your blood pressure checked before?
Yes.
Good. It'll be tight for just a little bit. It should not be uncomfortable. If you do feel pain at any time, just let me know.
Sounds good.
And you can rest your arm. Okay, I'm going to take my stethoscope. I'm going to put my stethoscope on your arm. It'll be just a little bit cold. Okay, I'm going to start pumping now. All right, your blood pressure is 119/78. Which is very normal, okay? It looks wonderful.
Thank you.
Okay, Luna, we're going to listen to your heart and your lungs now. I'm going to have you breathe normally at first, okay? Just going to warm this up. Okay. Breathe normal for me. Okay, your heart sounds really good. I don't hear a heart murmur. It's not skipping a beat. It's not too fast. Just going with the other side now. Alright, so we're going to do some breathing exercises. Have you breathe in as deep as you can and breathe out. Breathe in as deep as you can and breathe out. And breathe in as deep as you can. Hold for 1 second. 1 and breathe out. Good. Everything sounds great. I'm going to check your lungs for any crackling. Have you ever had pneumonia?
No.
All right. What I'm going to have you do is put your arm to your shoulder. Turn a little bit. Just listening. Breathe in Breathe out. Breathe in. Breathe out. Breathe in. Hold for 1 second. 1. And breathe out. Relax. Good. Your lungs sound just absolutely perfect. So Luna, what I'm going to do now is I'm going to put pressure on your head and I'm going to ask you if you feel pain, okay? If you feel anything, please let me know.
Sounds good.
Providing pressure, releasing pressure, adding pressure, releasing pressure, adding pressure, releasing pressure, adding pressure to the back of the head, releasing, running my fingers through the hair, looking for anything abnormal, any bumps that might be of concern. Circular motions at the back of the head to look for any small bumps that are normally not easy to find. If there is any, sometimes they can be hidden as your head does have different angles to it. I'm not feeling anything there. I'm going to move on down to your ears. Slight pressure on your ears. 1, 2, 3, letting go. Underneath the ears, close to the tonsils, pressing in, 1, 2, 3, letting go. Any pain there?
No.
Running my fingers down the neck, to the clavicles, back and forth. They feel very good. They feel evenly distributed. Feeling underneath the jawline, touching the tonsils, pressing and releasing, looking for swollen tonsils. No swollen tonsils there. Feeling the neck, holding, releasing, holding, releasing. Nothing abnormal, no pain, nothing to be concerned with. Run my fingers up and down your trachea. When I say swallow, if you could do so, please. And if you could swallow, trachea is intact. In the middle of the neck. No bump. That looks really good. Bring onto the shoulders. Feeling the shoulders for any bumps. Tenderness. Tightness. Holding. And releasing and looking for circulation on each side. Looks really good. Shoulders look even. I'm going to move on now to just tapping on your face. If you could just tell me if you're in pain, that would be great. Good. You can just stay there. I'm going to measure the circumference of your face, your head. go in and measure everything else that I just palpated, just to get an accurate measurement. You could look to your left, measuring your head from the bottom of your chin to the top of your head is about 9 inches. Your ear is 2.5, almost 3 inches. Jaw from one side to the other is 5 inches. If you could just look straight at me, keep your eyes closed. Your forehead from one side to the other is 6 inches. Your nose is 2 inches. And your mouth is 3 inches. Could you look to your left? Jawline, 4 inches. Top of your head to your jawline, almost 8 inches. Nose, cheekbone, 4 inches. Ear, 2.5 inches. If you look straight at me, I'm going to look at your shoulders. Neck to the beginning of the arm, 6 inches on each side. Chin to the clavicles, 4 inches. Shoulder to shoulder, 15 inches. Looks really good. Luna, you are looking really good so far. I want to take a deeper look into your skin on your face and your neck. I'm going to use my magnifying glass here. Just going to put it on. And I'll be using a special light to take a deeper look, okay?
Sounds good.
So I'm going to go in from this side here. And if you could actually look to the left of you, take a deep look here. Pores look good, not too big, not too small. I do see a freckle, 2 or 3. Normal response to sunshine, depending on the ethnicity that you are. You are looking really, really good. You have beautiful skin. Just seeing how your skin reacts to a little bit of palpation. Taking a closer look at your ears. Going up towards your forehead. See how your skin reacts to a little bit of stretching. Good. Skin close to your head looks really healthy. See a few baby hairs here. Hairs growing. Okay. Good. Okay, gonna go down to your neck. I do see a mole back here and another one. Not discolored. They don't look worrisome. Your neck looks really good. Skin is reacting well to palpation. Nothing super red. Don't see dry skin. Don't see abnormal bumps on skin or eczema. And the skin is looking really healthy. I don't see large pores. Normal skin color. Skin matches the neck, just really good. Skin looks intact, hydrated, Hair follicles look really good. At the hairline. Ears look really good. And the neck looks really, really good as well. I can have you look straight at me to your forehead, down to your nose, down the side of your nose. Okay, looks good. At your top lip, bottom lip, and your chin and your jawline. I'm gonna have you look more towards the left. Seeing how your skin reacts to palpation. No immediate change in color, a normal response. Something that I'm looking for. I'm not looking for a quick red response. You want your skin to look very similar to what it did before touching it. Does the ear hurt?
No.
All right. Your skin looks really good.
Thank you.
I don't think you have anything to be concerned about when it comes to your skin. Okay, Luna, your skin looks really good. I'm gonna write a few things down and we'll continue on to your scalp check, okay?
Sounds good, thank you.
You're welcome. Skin looks really good. No signs of eczema. No signs of psoriasis. Skin is even with color. Reacts well to pressure. Looks really good. Nothing to be concerned with. I'm going to go ahead and do a scalp check if that's okay.
Sounds good.
Looking for lice. I'm assuming you don't have it, but we're going to double check anyway. I'm going to look for flakiness, redness, bumps, anything that could be concerning, okay?
Sounds good, thank you.
You're welcome. I'm going to have you look to your left. Skin, very light dandruff, very normal. Skin is not dry. It looks very hydrated. Could you look down, further to the left? Back of your head. Take this clip out. everything looks really good on this side. We're going to move on to the other side now. Okay, we're going to start off on this side. To clip up a little part of your hair since you do have very thick hair. Skin is looking really good. Healthy, hydrated. A little bit of dandruff. Completely normal. Hair follicles are thick, evenly distributed. No alopecia. No signs of balding. No signs of hair loss. Just looking at your ends, they look really good. I don't see many dry ends. How often do you wash your hair?
Every other day.
Pretty normal. Can you look down? Back of the head. Put your hair down on this side. Alright, that concludes our scalp